I want to share with you some of my frustration in trying to contour the tumor bed in the breast. Everything else we do in radiation oncology, we can be very precise, and this, I think, involves a lot of estimation and guesswork, which is really frustrating and something that I think we need to do better going forward. So here's a typical breast cancer patient of mine, and we can see as we scroll through the breast, there's density in both breasts. The right breast is the side we're interested in. You can see that we put a marker on the skin at the surgical site. You can see just adjacent to the nipple here, we've got a little extra density compared to what's on the other side. I assume that that represents tumor bed. It's kind of hard to be sure. I do have a couple of clips that guide me, but not sure that they completely define a volume. So I like to contour with a brush. You may do it with a different tool. And typically what I'll do is I will contour what I see with the fiducials, but I will also contour what looks like the adjacent density. And you can see this area. This looks like it's probably a tumor. I'm not exactly sure. Tumor bed, actually, to be more precise. And there's no more clips going in that direction. So moving back down, so there's the clip. I think this is part of the tumor bed. I'm pretty sure this is, although I'm really not sure. Where do I draw the line here is really hard to tell. It's kind of a guesstimate, and I don't like doing guesstimates. As I move further, again, where's the line? Is this it? Is it a little more to the left, a little more to the right? How about this tissue? Is that part of it? Is that not part of it? I think it is. And oh, there's a couple more clips that are kind of out here. And again, where do I draw the line? Do I stop it here? Do I come all the way here? I really don't know. Is this still tumor bed? I think so. I'm not sure. I'm going to include it. And then we're going to expand that for my planning target volume. But this is essentially what I see as the biggest frustration with breast cancer contouring. I'm going to interpolate this and just show you what I've come up with. And once again, is that the edge? Is this part of it or not? Really hard to tell. And part of the reason is I've just got a few clips that don't really define a volume. They define a couple of points in a plane, but very hard to know. And even looking on the sagittal view, is this density? I'll make that bigger for you. Is this density going superiorly? Is that part of the tumor bed? I don't think it is. There's no fiducials in that vicinity, but it sure could easily be contoured. And again, where I draw that line is absolutely arbitrary, and I hate doing that as a radiation oncologist where I don't know precisely where my target volume ought to be. So that's my frustration with breast cancer contouring as it currently stands using fiducial markers.